Some people are just legitimately bad at pooping, like coordination wise, and I'm going to teach you a way today to sort of check and see if you might be one of those people. There's actually a term for this. It's called dyssynergic defecation. Dyssynergic meaning not synergistic or not working together, and defecation, of course, meaning to poop. Basically, what it means is we are not coordinating our anal sphincter muscles, or the muscles that hold our anus closed or hold back our poop, as well as our pelvic floor muscles. We're not coordinating those, which need to relax when we poop, with the muscles of maybe our abdomen, which might help to add some pressure or push downward when we go to the bathroom. Those two things need to be working together in order to have an effective bowel movement, and for some people, they just don't really work together. I'm going to teach you a way to do a little self-assessment to see if this might be a problem for you. Now, some people might feel like this is a little bit gross, but I just call it getting to know your body. So this can be done while sitting on the toilet, and what you want to do is you want to put one finger at your anus. Yes, I want you to actually feel what your anus and your anal sphincter are doing, because right around this ring right here, that is your anal sphincter, which is that muscle which is holding things back, and it needs to be coordinated when we go to the bathroom. And then I want you to maybe put another hand on your abdomen or on your stomach so you can feel if those muscles are tensing up also. And the first thing you want to do is think about squeezing like you're trying to hold back poop or hold back a fart. And what you should feel is that anal entrance right here, sort of squeezing closed and upwards a little bit like that. You shouldn't really feel anything happening in your abdomen, maybe a slight tensioning, but it shouldn't be like a strain, or you shouldn't feel your glutes engaging or your legs engaging. It should be just that muscle right there. Then you're going to relax that. Make sure you just can kind of like let that go. Make sure that when you go to relax, it doesn't just stay tense. And then I want you to think about gently bearing down as though you are trying to pass gas or have a bowel movement. Now, here's what you want to watch for. You want to feel that anal entrance sort of softening and opening up and sort of pressing downwards slightly. You shouldn't really feel anything happening in your abdominal muscles. You shouldn't feel like they're straining, they're tensing. You shouldn't feel anything happening in your glute muscles. You should just feel a nice sort of softening and opening of that anal entrance. Now, for people who have dyssynergic defecation, they might be doing one of a couple of things. Instead of relaxing downwards when they go to bear down, they might actually be contracting instead. So if we feel a contraction up and in and squeezing closed when we're trying to bear down, that's a problem. Also, other people, they may not be squeezing, they may just not be relaxing. So if you go to try to bear down and all you feel is your stomach tensing up, but nothing happening at your anal sphincter, that is also a form of dyssynergic defecation. For some people, this leads to what we call functional constipation. So if you find that this is a problem for you, pelvic physical therapy is generally considered the first line treatment.